Thank you so much. Thank you for having me. I'll speak today about Morbus Darier disease, a known disease, which is a rare autosomal dominant disease. It is sometimes difficult to treat this disorder. It is sometimes challenging, and the patients has symptoms over the years without really or without finding a good medication to treat this disorder. We know, all of us knows that the Morbus Darier is something or was described by a scientist before around 150 years. The main problem in this disease that the patients came with war-like papules, and they have also symptoms like bad itch or bad smell and very, very bad pruritus, or they have to itch all the time. Sometimes the patients have also nails involvement, sometimes the squamous tissue also involved, and the patients always try to find a solution to this problem. We can say that the trigger factors are variant. The heat will make the symptoms more and more, humidity, the UV light, friction, and what is also known and described by large number of patients that the stress will make the situation worse. In this issue or in this disease, we make our diagnosis by inspection and also the history of the lesions. Sometimes the patients told us that there is somebody in the family which has the same problem, and the problem can be in a few lesions, and also it can involve all separate areas. I mean the back, the neck, sometimes the breast, and also the forehead. If you need to make a diagnosis, you have to make a biopsy and to send it to the histopathology. The histopathology can say, okay, it is now dyskeratosis follicularis or Morbus Darier as diagnosis. I will introduce today a case report which I treated with Erbium-YAG laser. The issue was here that a patient came to me. He is 38 years old with skin type 2. The whole back and neck was involved with Morbus Darier, and the diagnosis was made before around 20 years, and multiple times biopsies were done, and in every time the diagnosis or the diagnosis came with Morbus Darier. This patient has suffered from diabetes mellitus type 2. He was also obese. The body mass index was 51. He has also sleep apnea, and a main problem here that his intellectual status was with low IQ. So it was not very easy to treat him, for example, with tablets or with traditional treatments. But he told me that he tried in the last 20 years a large number of medication, local treatments, creams, etc. And also he tried for 2 or 3 times to take antibiotics, but they did not help him a lot. The problem was that the symptoms sometimes goes away, but it come back when he, for example, stress, or when he has stress in work, or when for example, the humidity is more, or when the summer comes. Also, he has hyperlipidemia. He was under variable medications because of all of these comorbidities. And after that was the question, how can we treat him? I would like to introduce the picture or the image of his back before starting the treatment. You also, or everyone can see how is bad to have this disease. Here we see that the skin is very red, with also crusts and papules. As I said before, his main problem was itching. He told me that sometimes he cannot sleep because of itching. And also, he cannot go, for example, to a swim bad, or he cannot sometimes go outside without clothes which cover the neck area. And this come the question: how can we treat this disease? I think all of us know that we have 3 options. We have the topical therapy, we have the oral therapy, and before some years, the suggestion was to treat also Morbus Darier with fractional laser systems. So as I said, he told me that he tried some local medications, topical, for example, salicylic acid or hydrating creams. And I think also he became, for more than one time, the topical steroids. We know that the topical steroid will make the symptoms a little bit better, and he will be happy for example, 2-3 weeks. But after he stopped using the topical steroids, unfortunately, the symptoms will come back. So this was the first line of treatment, topical therapy. He tried some of them. The second line was the oral therapy. He got also antibiotics for multiple times. The same issue as topical steroids, because when the superinfection came because of Morbus Darier, the antibiotics will help a lot, but it's not a long-term treatment. With oral retinoids, I was a little bit not happy to give him the oral retinoids because of 2 problems. The first time, that he hyperlipidemia has, and the second point that with his low IQ, I was not really happy, or I cannot 100% know if he take the medication in a proper way. And also, as you know, we have to make the blood test at the beginning, every 4 weeks, to be sure that the liver test is in a normal level. So it was difficult, and after thinking, I decided not to give him the oral retinoids. After that came the idea to treat him with Erbium-YAG laser. As you know, we have 2 known fractional ablative laser systems, Erbium-YAG, CO2 laser. The advantage of Erbium-YAG that it is a little bit superficial if we compare it with CO2 laser. CO2 laser, if you are not experienced physician, you can very easy and they will make scars for the patient. Also with the laser or with Erbium-YAG laser, I decided to give him some topical treatments. After I used the laser therapy, I advised him to use some urea creams, but I have to make it clear that we have to be careful if we use, for example, salicylic acid or urea, because sometimes if he has an lesions or an open ulcers, it will make the itching more, and it will not help a lot in hydration. So I used the Erbium-YAG laser with these wavelengths. It was 2,940 nanometers. Our target structure here was water. It is very, very important in each laser therapy to know what our primary target structure. Because if we do not know the target structure, it is very easy to have side effects and complications. I use here also the 400 joule per pulse, 10 hertz, and the total power was 4 watts. Is Erbium-YAG laser an effective method to treat Morbus Darier? As every treatment, we have always advantages and disadvantages. The advantages here was that the Erbium-YAG laser is a one-session therapy. If you use the Erbium-YAG laser to treat Morbus Darier, you can make a good result in one treatment, and the symptoms will improve after one treatment. So it is very effective, and the good thing is it will be without recurrence. I will highlight this point for another time, the disadvantages in using ablative laser systems in treat Morbus Darier, that if somebody without enough experience treat the patient, it is possible to make scars. So we have to be very, very careful. And I think if some doctor, some physician, or some dermatologist, or if dermatologists are not very experienced with this method, I advise him to treat just a small lesion and to send the patient to the home. And after 4 to 6 weeks, he has to recheck the situation. Does it help? Does it not help? Has the patient complications or not? And after that, he can move away and treat the old papules or lesions. The second disadvantage here is the pain. As you know, when we use ablative laser, it will make pain. Here you can, for example, use anesthesia, local anesthesia with lidocaine, for example, half an hour before the treatment. But it will help, but I cannot say that the patient will develop kind pain during the treatment. I will let you see the situation or the picture before therapy for another time. So I need to say that I treat him. The treatment, I make the treatment, and the time for this treatment was around 1 hour, because you have to go above every lesion, and you have to make the treatment. So it's not easy to make the treatment. You have to have a little bit patient. Now we can see the picture after 7 days. After 7 days, as you see here, the crusts goes away, and he, after 7 days, start to use the local therapy, the local treatment. Yet after 5 months, he visited the clinic. He was very, very happy because the first time since 20 years, he has, can we say, as normal skin as the others. And after 1 year, I made also this picture, and here we can see that the hair come back, and if you see this picture now, you cannot imagine that he has before 1 year Morbus Darier disease. So my home message point is, please try to use Erbium-YAG laser to treat Morbus Darier. It is an extremely effective method to treat this disorder. As you know, a picture is worth 1,000 words, so I will let you see the pictures for another time. This was before treatment and this after treatment. And after a year, the patient was very, very happy, and me too also. Thank you so much for your attention.